Good afternoon. My name's Anne Coveney. I'm from Community Dental Service, and I'm going to do the session today all about children's health. Okay, who we are, what we do. Right, I'm part of Kent NHS Community Dental Service, and I'm part of the outreach team for Newham. Having said that, I don't work in Kent. I've always worked in Newham. Right, we give services to inner and outer North East London. We give oral health education. We do fluoride varnish programs and supervised toothbrushing in all boroughs from Havering into the City of London. So all the boroughs we have clinical services in. How do we improve our children's oral health? Well, how do we improve everybody's oral health? Just by brushing. Brush twice a day. Okay. Think of what we're actually eating. We give diet advice. We just think what we're actually eating, what we're snacking on, especially with our children. Children's enamel, the white part of the tooth, is much softer than our teeth, so it decays really quickly. Also, like regular visits to a dentist. I know that is quite difficult at the moment, but so that's why it's more important now to brush children's teeth and adults' teeth. You know, just keep on top of your oral health at the moment. Can we go to the next slide? Right. Okay, this slide actually shows that we average with our 5-year-olds, the latest study that was done in 2019, because the study's now been put on hold, right? It was averaging 23.4% of 5-year-olds in England have experienced tooth decay. Now, if you look, Newham is 36.3. So on average, that means 3 to 4 teeth are affected in our 5s and under. This actually can cost the NHS 50.5 million in GA appointments. Okay, do you want to go to the next one? Right, this actually shows you dental caries. On the top left is what we actually aim for. This is what we talk to parents all about caries free, having children with no tooth decay whatsoever. Nobody has to have tooth decay. It's totally preventable. The picture next to it on the upper the upper right, that actually shows demineralization around where the gum level is. Basically, that's because if children are on bottles or if children brush their own teeth, they will actually leave plaque bacteria in that area. So what happens is the teeth start to decay. So that is the first signs of demineralization. That's the first signs of tooth decay. The picture on the left, lower, is of a child who's had bottle caries. So that means that a child has been on the bottle for more than a year, has most probably been put to sleep with a bottle at night. So those teeth are all decayed. The lower right is showing a child before they go into a general anaesthetic to have the teeth removed. Now, those molars that we're looking at, they're deciduous molars. They actually stay in the mouth until they are 11, sometimes 12 years old. So when we take them out pre-5, they don't have any teeth there for most probably 6 years. So what happens is when their first adult molar comes into position, which comes in at 6 years old, and it comes behind those deciduous molars, when it comes into the mouth, it drifts forward and it takes the space up. So then what happens is when their adult teeth start to come in, they come in all different places, and that's why lots of children end up with orthodontic treatment, which is the having the braces on the tram lines. So do you want to go to the next slide? Right, this one, right, it says that most common admission to hospital, 5 to 9, is to have a general anaesthetic, take teeth out. Now, lots of parents think, oh, they're going to have their teeth out and we'll be there an hour. It's not so. What happens is children are admitted at 7 in the morning. They most probably will be there for a complete day, because it's all according to how they go down on the general anaesthetic list. So the list goes to 1 o'clock, so it usually starts at 8, goes to 1. So children go into theatre from 8 to 1. So then they have to come back and recover on the ward. So we can't just let them go home until they're fully recovered from the anaesthetic. So parents can be at hospital all day. So, you know, and it's so traumatic for children to go to a hospital just to have a tooth out. Sometimes it can be one tooth, sometimes it can be multiple extractions. Also, if you look at the picture, which is on the right-hand side, this will show you what I was talking about before, about when we take the deciduous molars out. If you look at the very back of this child's jaw, you can actually see the 6-year molar coming into play. So once we take the 2 teeth out before the 6-year molar, once we take those out, and there's nothing there to stop, when that 6-year molar comes into the mouth, it will drift forward and take up the space. Okay, so like, you know, just brushing children's teeth is so important. So can we go to the next slide, please? Okay, the importance of children's teeth. Right, children's teeth is, right, it helps them to eat correctly, it helps them to speak correctly, and it's also about their well-being, their socialisation. Because if we take children's teeth out, and we quite often take their front teeth out as well, so what happens when they're in nursery or in school, they go back and the other children want to know where their teeth are gone. So that makes them self-conscious. So it's all about their well-being as well. Can we go to the next one? Right, this is about early childhood bottle caries. This is what we see a lot in Newham. Okay, so what we say is once they're one, right, by they're 1 year old, they should be off the bottle. So once they are 6 months, sitting up, start to introduce a cup. Okay, because it helps with the way their jaw grows, right? Because if they're continuously on a bottle, they are sucking, so they need to use all the different muscles in the jaw. So if they're kept on bottles, it can impact on the way the jaw grows. Never ever put them down with a bottle. So loads of parents put them to sleep at night with bottles, and what they do is, because they put them to sleep with a bottle at night, they put milk in it. So the child will then suck on the milk, and then what they do, they hold it here, like so in their sulcus, so like bunny rabbits, and they drink from that area. But what happens is all their teeth are covered in milk. Milk's got sugar in, and if there's bacteria in the mouth, the sugar will react with the bacteria, the saliva will become an acid, and the children's teeth are attacked. Now, once they drink from their sulcuses, they suck more in, and this carries on all night long. Then they could wake up and the bottle is replenished, and then that carries on. So their teeth are on what we call in an acid bath all night long. Okay, never dip gummies in anything like sugar, Nutella. syrup, honey, right? Dummies are just a pacifier. Dummies are fine, but as I said, they're a pacifier. Midwives don't like to introduce a dummy before 6 weeks because it can actually have an effect on the way a baby will latch on for breastfeeding. And also, like, dummies shouldn't be kept in the mouth all day long. Like, you'll see children walking around a supermarket with a dummy. You'll see children in a pushchair with a dummy. Dummies are only for sleeping. They are what they are. They're a pacifier. And also, like, parents shouldn't be licking the child's dummy to make it clean either, and then put it into the child's mouth. So dummies are just a pacifier. Right, water is the only safe drink that we actually have. So once children have their teeth brushed at night, it is only water after that. So once you put children down to sleep, right, they shouldn't be given the bottle, right, and they shouldn't be drinking from milk all night long. If you look at the picture on the upper right, it will actually show you this is bottle caries. Now this will happen once the children get their first teeth starting to come into the mouth. So that's why we say get rid of the bottle by one, get them drinking from a cup. Breast milk can even go in a cup as well. And always clean children's teeth before they go to sleep at night. Right, next slide, please. Right, this shows like toothbrushing. Toothbrushing starts as soon as teeth appear. So once the tooth starts to cut through the gum level, and I always say to parents, when you put your finger in, you have a little feel around, you feel it a little bit sharp, start to wipe over. Now, lots of parents think, oh, I can't put a brush in because baby's too small. Some children get teeth at 4 months. Some don't get none till 6 months, 9 months, past a year. We're all different. We all do things at different times. So therefore, right, as soon as baby starts to get a tooth, you need to start to clean. So, as I said, some parents don't like putting a brush in first. So there are things that can be bought. There are finger brushes that you can buy. There are also finger wipes and swabs that you can use. Parents can also just use a flannel just to wipe over. All you're removing is the plaque bacteria, because as soon as that tooth starts to erupt into the mouth, plaque bacteria will just attach itself and it will start to attack the enamel. Because breast milk is highly sweetened, formula milk is highly sweetened. So all those things, as soon as they go in the mouth, that all reacts with the bacteria and the saliva becomes an acid, and that starts to attack that enamel on that child's teeth. So they need to start brushing twice a day. Small baby-headed toothbrush, and I can put a tiny little bit of toothpaste on, just a tiny pinhead of toothpaste. Children all need supervision until 7. Some children need it after, but basically it is till 7, because children don't brush their teeth the same as we do. So their little wrists don't work like ours. So they cannot actually clean all their teeth. They all say they can. They're all very independent and they all think they can. So we say, well, let the child brush first and then you just go around after just to make sure they're actually clean. And also clean where the teeth and the gums meet. Because as you saw on the previous picture, when I said about the demineralization of the enamel, that is where a child's teeth has been brushed, but they haven't got the plaque bacteria away from where the teeth and the gums meet. And also, don't rinse, just spit. Right? No water. Children don't need water. No one needs water. We all should be just spitting. no rinsing. Okay, this just shows you the amount of toothpaste that should be used. Okay, so 0 to 3 is just a very small amount, just a little tiny dab, a little smear. Over 3 is a pea size. Now, it's on the fluoride levels on these toothpastes, right? Children can all use 1,450 parts per million toothpaste. Basically, that is an adult strength toothpaste. And also, because London doesn't have fluoride added to its water, so parents don't have to buy age-appropriate toothpaste. They can just buy 1 tube of toothpaste and use it for all the family. Quite often, when children have had age-appropriate toothpaste and then parents try to introduce an adult strength toothpaste, they go, oh, it's too hot, because our toothpaste is more spicy, basically. So what I usually say to parents is, well, if you just buy the highest age group for children's toothpaste, which is 1,450 parts per million, the whole family can use it. Otherwise, some parents are buying 2 and 3 toothpastes, right? And it's very expensive for parents. So, as we said on there, it's just a little smear for 0 to 3s, pea size for 3-year-olds, and if parents are using it as well, just halfway along the brush, and just brush and spit, no rinsing. Okay, Joanna, do you want to go to the next one? Right, this is just child-friendly tools that can encourage children to brush, because a lot of parents find it quite difficult to get children to brush their teeth. So there's games, there's some charts out there, and you can get them with stickers. There's colouring, and there's sounds that they can get. There's lots of things on our telephones now with our apps, which are all like little jingles which get children to actually brush. And and it's good to get children to brush with parents, because children follow what parents do. Okay, do you want to go to the next one? Right, we actually treat like special needs. So special needs children can actually come to us in our service, because we are only a referral service. Parents can actually refer. All health professionals can refer as well. Right. We do sessions with special needs parents, and in schools we also have supervised toothbrushing going on in schools, but at the moment all that is stopped because the schools have got reduced staffing and they're finding it quite difficult. So all those schools, all those children get brushing packs to take home with information for their parents. Now we talk to everybody about it, like parents and so forth, and about the schools, and we say to parents that sometimes you can use an electric brush with some of the children. Some like that, others don't, so it's like hit and miss. You just need to try. Right? Also, like there are toothbrushes that are 3-sided on the market, which is Dr. Barman's brush, which we actually use with dementia patients and also special needs patients, and you're brushing 3 surfaces in one go. There are some patients can't stand, especially if they've got a swallowing reflex, so they don't want a foaming toothpaste. You can try Oral Nurse. If you can't get Oral Nurse, Sensodyne Pro Relief is another one that doesn't foam up. Right, so there is that. You need to press the toothpaste into the actual bristles on the brush to prevent anybody swallowing the toothpaste. Okay, and try to establish a routine with special needs children because they like routines. So you need to try and establish a special need. Always try to do it when they are more relaxed. So don't make it a chore for them. Like, you can also, if you're brushing children's teeth, you should really try to stand behind them. So they could sit down actually if it's an older child, but very young ones, we need to stand behind them because we need to actually support their neck. Okay, so we can do that. If it's special needs and they're like immobile, we can brush, and the same as this is what we do as well with older people that are immobile. Like, we brush in their beds, so we try to turn them on their side, or try to turn the face onto the side. We put a towel underneath, and then we will brush and wipe. But everybody does need their teeth brushed. And I know parents go, oh, but you know, they just won't have it, but they're doing good. Like, trying to stop the bacteria in children's mouth. Right, can we go to the next one, Joanne? Oh, yeah. Right, this one here, this shows disclosing. Some of you may know about disclosing. Some may have had it done. Some may go, their children, you know, some of your children may have had it done. But what we do when children come into us in the clinic, what we do, we get them to brush their teeth. We give them a disclosing tablet to crunch up, and we get them to wipe it all over their teeth and then spit out. This can also be done with food colouring, but you actually need to do it. If you're doing it with food colouring, you actually need to put Vaseline on your lips first, otherwise you end up with the same colour as what you're using inside your mouth. So your lips could go yellow or bright red, whatever you're using. Right, and then we get them to spit out. Excuse me, we get them to spit out. They then look in the mirror and they can see when they're not actually brushing their teeth. So we get them to stand and actually brush their teeth until they're clean. This gives children, and adults can use it as well, it actually gives them an idea of how to brush correctly. Okay, because as you look at that picture, you can see where the plaque has been left, and it is the top of the crown of the tooth where the teeth and the gums meet, and that is normally where tooth decay will start. Okay, do you want to go to the next one? Right, this one is about diet advice. This is little and often is not good. Little and often can cause tooth decay. Fizzy drinks, they're not good. Juice drinks, they're not good. If you're giving any juice drink, especially parents buy carton juice because they think that's good for their children. If parents are buying that, if children are under 5, it is 1 part juice to 10 parts water, and it should only be taken at meal times and not in between. I know it might be a bit boring, but the only safe drinks we've got is plain milk, plain water. Okay, we try to say, think about how often you are consuming sugar. Try to cut down on that. Try to just keep sugary things to meal times. Safe snacks in between meals. Also, fresh fruit and vegetables are really good. Children can have vegetable sticks with a dip. They can have a piece of fresh fruit. And always use sugar-free medicines. Okay, do you want to go to the next one? Okay, this is the actual sugar allowance, which parents can actually download on their phone. This shows you how much you should be taking in per day. So, and it gives you 4 to 6 year olds, and it actually goes right the way up to adults. So if you look, you can see our one. So we should only have 7 teaspoons of sugar a day. And I'm sure we have much more than that. But we do need to look at what we're actually eating. But this is a good app because they can take it to the supermarket as well to find out how much sugar is in each product. Okay, do you want to go to the next one? Right, this is just like a prompt, just to let you think about what is good and bad. So, okay, we all know what the good ones are. So if we look at the bad ones, we're looking at Coca-Cola. We're also looking at tomato ketchup, which people think, well, that's good. It's made tomatoes, it's got fruit in, so it's really good, but it can cause tooth decay because children have so much of it and they have it so often. So just be aware that that has got a lot of sugar in it. It's highly sugared. Honey, parents think, oh yeah, we'll give honey. Honey's okay. We put it in milk. They put it in bottles for the children. Honey shouldn't be added to bottles. It shouldn't be added to milk. If they're giving honey, it should just be a small amount of honey on their cereal, like porridge, because cereals are so sugared. So porridge is the best because all the children's like cereals, some of them have got 7 teaspoons of sugar in just one bowl. So parents do need to think about what they're actually giving their children. Okay, do you want to go to the next slide? This actually shows the Stefan curve. Stefan curve is pH level inside our mouth. Our pH level is 5.5. Anything below 5.5 will start to attack our teeth and start to demineralize the enamel. As I said before, children's enamel is very soft and it will demineralize much quicker than ours. So if we look at this Stefan curve, it actually shows you the blue line is like when we have a breakfast. So it will dip and it will go into the danger zone. Then it comes up and it goes all the way along to lunch and it will dip again into the danger zone. We can cope with that. We can't cope with what the green line is, where the child's teeth are in the danger zone all day long because they are snacking all day long on sugary drinks and sugary foods. Okay, we can all cope, and children can, with 3 to 4 acid attacks a day. An acid attack is where we take sugar into our mouth, whether it's with food or it's with drink, and that sugar then will react with the bacteria inside the mouth and the saliva becomes an acid. And our teeth are attacked for about an hour after we've eaten or drank. So you need to have a gap between breakfast, lunch and tea, right, or dinner. So you need that gap for your teeth to recover. Okay, do you want to go to the next one? Right, this shows little fella, quite happy, gone to the dentist. All children are free until they're 18 years old, 19 if they're in full-time education. All children should have a checkup as soon as a tooth erupts in the mouth. Now, a lot of parents go, well, why are we taking them? You know, they're only 1 year old, they don't know. But thing is, Like, it's getting them used to coming into our environment, coming into the different smells as in the surgery, seeing what the equipment is, and also if there is a problem, it is picked up early, so they don't end up with the tooth decay. And with children over 3, parents can also ask the dentist to paint their child with fluoride varnish. We do fluoride varnish programs in schools in all the boroughs, but they all have different amounts of fluoride. So in Newham, we do 1 application per year. So children can have up to 3 applications a year. In Tower Hamlets and Hackney, we do 2 applications a year. So that leaves that in Newham, children can have an extra 2 at their own dentist, and in the other boroughs, they can have an extra 1 application for the fluoride varnish. Fluoride varnish helps to protect their enamel against tooth decay. And all it is like a varnish painted on your teeth, tastes like bananas, and it takes about 30 seconds to a minute to do. Okay, do you want to go to the next one? Right, this is about trauma. Right, now this really affects children who are with their second teeth. This doesn't work with deciduous teeth. So if a child is in a playground or a child is playing, they knock their front tooth out, that's their central tooth, you need to pick it up by the crown only. Okay, it can be licked clean, or you can rinse it in some water, but don't over rinse it. Right, stick the tooth back into the socket if you can, but this, as I said, is only with adult teeth. Get them to bite on a handkerchief and hold it in place, and go straight to a dentist or to one of the teaching hospitals. Newham doesn't have any dental backup, so it would have to be either the Royal London or Whipps Cross, because they do have dental departments there. But don't touch the actual roots, okay, because the fibres that hold the teeth in place, which are periodontal membranes, are still alive. Okay, so do you want to go to the next one? This is our evidence base, and this is Delivering Better Oral Health Toolkit. You can actually look at this online. This will tell you much more about children's teeth and about adults' teeth as well. So, and it's absolutely free to look at. Okay, do you want to go to the next one? Right, thank you for listening. That is good. That is for you can scan our feedback form, which we would appreciate, to let us know how we perform. So thank you very much for listening.